We can take the measurements either with a vernier caliper like this, or with a small gauge, in order to determine the position of maximum intercuspation, MIC, or the position of protrusion. We ask the person to open her mouth and close her teeth together. This is MIC. We take the measuring device and measure 3 millimeters in this case. We ask the person to open her mouth and move her jaw forward as much as possible. We take the measurement again. We must try to be consistent at all times. Here the measurement is 7 millimeters. We must be consistent in regard to our reference point. We try to always rely on tooth number 11 and tooth number 41, or tooth number 21 and tooth number 31 in order to establish each of the measurements as precisely as possible. Subsequently, we ask the person to keep her chin as relaxed as possible and move it backward and then forward. In this case, we can see that the backward measurement is close to 5 to 7 millimeters. Then we ask for a maximum opening, so the patient must open her mouth as wide as possible. We take the measurement like this, from end to end. In this case, the opening is 43 millimeters. We ask the person to open wide while we place our hands on her temporomandibular joints. The patient closes her mouth, opens it, closes it, moves the jaw forward, moves it backwards, moves it forward, moves it backwards one last time, and moves it forward. The position must then be kept, and we make sure that both midlines, upper and lower, are aligned and that the lower midline is slightly to the right or to the left. To the patient, relax your mouth. We palpate the joints to identify any sound, creaking, clicking, crackling, or joint noises that might have begun several years ago, or that might have been noticed by the patient for the first time when he made the wide movements he was asked to make. To continue the examination, after examining the TMJ and taking measurements, we must take a look at the curve of Spee, i.e. the curvature, at the lower tooth level mainly. In this case, the curve of Spee is moderate on both sides. Then we examine the tooth wear. The anterior incisors are worn down. Their length is around 10% of the length of the incisors. To the patient, open wide, please. We ask the patient to slowly move her tongue backwards and to let it rest on her lower teeth. To the patient, stick your tongue in and let it rest, please. We will learn later how to identify or validate the Malampati class. I will take a look at the back of the throat. To the patient, open wide and say ah. I will press on your tongue to look at your uvula. We can observe the condition and the size of the uvula and of the soft palate. Determine if the patient has tonsils, and look at the bottom of the tongue to establish the width of the tongue, whether it is small, medium, or large. Then we ask the person if she has difficulty breathing through the nose.